Well, thank you, Chairman.
You looked lonely down there at the end of the panel.
I know it's a long way down here, and I'm afraid Secretary Azar is going to get a crick in his neck that will require medical treatment from having to turn so far to see me. I appreciate it. When we met in my office, I showed you, I think, one of my favorite charts, which is this one, which shows the CBO estimates for total federal medical expenditure. And the red line along the top was the predicted total federal medical expenditure as of 2010. And then the Affordable Care Act went into effect, and time went on, and it turned out that instead of that red line, what actually happened was that green line. And then here in 2017, CBO did another forecast. So from this dot forward, the green line here is the newer forecast. As you know from our budget process, we think in 10-year increments in the budget process. So this green area is the 10-year budget window from 2018 through 2027. And in that period, we reduced anticipated federal health care costs by $3.3 trillion, according to those estimates. Now, I don't know how that happened. And I've got a terrific staff, but they're not like your staff. I think it should be a matter of urgency to try to really think hard about why that happened. And I hope that you will take a look, because if we can find $3.3 trillion in federal health care savings without inflicting pain on seniors and other beneficiaries, that's a goal worth fighting for. Now, my sense of it, to go from the global scale down to local, is it has a lot to do with delivery system reform and payment reform. And I want to focus on the group that I mentioned to you, I think also in our meeting, the Coastal Medical Provider Group, a primary care provider group in Rhode Island, which was one of the early pioneer ACOs. In the 5 years that they've been an ACO, they have reduced their cost per patient per year by $700. And they weren't high flyers to begin with. In 2016, which is the year we've got the last complete data for, they were down $700 from their previous measure, but they were down $1,000 from the average. So it's not like they were one of the most expensive people saving. They were actually doing better than average when they began, and they still saved $700 per patient per year. And the patients couldn't be happier, I can tell you firsthand, because those savings came through better service and better care. So it seems to me that if you take $700 per patient per year and you spread that across the federal healthcare system, you start to look at numbers like $3.3 trillion, that there's a connection perhaps between the payment reforms that empowered Coastal Medical to change their means of practice to save that money and better serve their patients, and that big projection savings that we're seeing. So I just want to flag that for you. We saved CMS $28 million with what the Coastal Medical people did. $28 million is not big bucks to you. You'd probably have to put a B instead of an M in that. But in small Rhode Island, from one provider group, to save $28 million is pretty significant. And you start adding in the multipliers nationally, and I think there's a big gain here. So I really want to work with you on this. I would urge that the more that we talk about repealing Obamacare and having those fights, fine if that's what you want to do. I don't think that's good policy. I don't think that's good for the recipients. I don't think that's good at all. But what I don't want is for you to get so involved in that fight that you won't work on the delivery system reform piece, which I think is strongly bipartisan, is completely beside the Obamacare wars. I don't think the people who want to repeal and replace Obamacare the most want to go back and repeal and replace the ACOs. They'd have an explosion from their home state doctors and providers if they tried. So I think this is a safe bipartisan place where real progress can be made. And I just want to take my time with you today to urge that And we are counting on a visit from you at some point to meet Dr. Kuros and his coastal medical team up in Rhode Island. We have other primary care physicians who are producing similar results, and there's a lot of excitement and satisfaction around that.
If I could say, I totally agree about the need for the value-based transformation. I think it's a bipartisan issue. That we can improve quality, we can decrease cost, and we can make all of our programs more sustainable the more we can do that.
And I'll just give you fair warning that I'm going to be harassing your folks at the staff level for more information out of like the macro program, the MIPS program, the Center for Medical Innovation, all those things. So I hope I'll get good answers to my questions. Thank you.